Hey everyone, today we are going to discuss regarding Beta Thalassemia Major. Beta Thalassemia Major or Cooley's anemia, we are going to discuss all the important points. So please don't forget to jot down all the key points. And please stay tuned till the end of the video. We are going to have lots of learning. Okay, so Beta Thalassemia Major, Cooley's anemia is seen across the globe, but more common in certain races and in certain endemic areas are there. And Beta Thalassemia Major is characterized by both the abnormalities in both the genes of beta globin production are abnormal. So it could be beta 0 or beta plus, both the genes are abnormal and leads to severe decrease in beta globin chain production. Almost absent the beta globin chain production is seen. So what happens here, excess of alpha chain will be there, which gets precipitated. The alpha chain laden inclusions get destroyed in the bone marrow, or even in the splenic macrophages also try to get rid of that beta alpha chain laden inclusion. So that causes excessive destruction of the red blood cells. So the red blood cells undergo hemolysis, and what will happen if there is a hemolysis? There will be bone marrow will show erythroid hyperplasia, and lab investigation will show all kind of abnormality with lots of hemolysis features like nucleated RBCs, target cells. All those features will be seen over here. Hemoglobin level goes down to even 3 to 4 gram percentage occasionally, and always remains in a moderate and never will remain around the normal range. It will always be moderate to severe anemia will be generally there. There will be splenomegaly because there will be extramedullary hematopoiesis due to marked hemolysis. So there may be splenomegaly, sometimes even hepatomegaly may be seen, but more commonly splenomegaly. And a patient will have erythroid hyperplasia in the bone marrow. That will lead to bone expansion, bone marrow and hyperplasia, bone expansion, and there may be some abnormal radiological features like crew cut appearance, hair on end appearance, and there may be some abnormal facial characteristics that is known as chipmunk faces due to jawbone expansion, so that is known as a chipmunk faces. So these characteristic features will be there, and the patient requires frequent episodes of regular episodes of blood transfusion to thrive. Otherwise, the hemoglobin concentration will go down drastically, and there is also need of desferrexamine because we give regular blood transfusion. So to chelate that, iron chelators have to be given. Splenomegaly may be contemplated in some cases, and even bone marrow transplant, which is the ultimate curative, but again it is laden with so many complications. Bone marrow transplantation will be there. So these are some important facts of beta thalassemia major. So let's have a quick recap of beta thal major, characterized by both abnormality of both the beta thal genes, both beta globin genes are there, and there is a severe hemolysis due to unpaired alpha chain production, and there is a marked hemolysis, bone marrow expansion, chipmunk faces are seen, and the treatment is done by splenectomy or regular blood transfusion, iron chelator, and bone marrow transplantation are being given. And another thing I would like to add about the electrophoresis finding. Electrophoresis finding, here you will see absence of hemoglobin A, and hemoglobin F will be almost 90%, and almost to 10% will be hemoglobin A2. So these are the key features of beta thalassemia major.
Thank you for watching the video. Please subscribe to the channel, hit the bell icon and follow in our different groups, and please stay tuned for the next video.